High-dose vitamin D supplementation is a controversial topic, with some experts advocating its potential benefits for autoimmune diseases, while others strongly warn against its risks. Although vitamin D is essential for bone health, immune function, and metabolism, excessive intake can have severe consequences. The body naturally produces vitamin D through sun exposure, but determining the right amount to supplement is complex. The global scientific community remains divided, with some specialists promoting high doses as a therapeutic tool and others emphasizing the dangers of overdose. One of the biggest concerns with excessive vitamin D intake is the risk of hypercalcemia, a condition caused by elevated calcium levels in the blood. This imbalance can lead to nausea, vomiting, constipation, fatigue, kidney problems, and even life-threatening heart arrhythmias. Experts caution that prolonged high-dose supplementation without medical supervision is particularly dangerous. While some claim that vitamin D toxicity is rare and depends on individual calcium metabolism, the risk of organ damage remains significant. The so-called Coimbra protocol, which involves ultra-high doses of vitamin D to manage autoimmune conditions like multiple sclerosis, is a particularly controversial approach. Patients following this regimen may take tens of thousands of international units, IU, per day, far exceeding the recommended upper limit of 4,000 IU set by the European Food Safety Authority, EFSA. Proponents argue that this therapy modulates the immune system and reduces disease progression, but scientific validation is lacking. Some experts, including neurologists and metabolic specialists, strongly advise against it, warning that excessive vitamin D intake can cause irreversible kidney damage. Patients undergoing this therapy must adhere to strict dietary restrictions, particularly reducing calcium intake, to avoid complications. Even under careful medical supervision, the long-term effects of such high doses remain unclear. The lack of large-scale, high-quality studies on the safety and efficacy of high-dose vitamin D therapy raises additional concerns. While some anecdotal reports suggest improvements in autoimmune conditions, there is no conclusive clinical evidence to support its widespread use. Without rigorous scientific validation, any claims about its benefits remain speculative. Furthermore, the potential dangers of self-administering high doses without proper medical oversight cannot be overstated. Many patients seeking alternative treatments may not fully understand the risks involved, leading to unintended health consequences. Even in standard supplementation, individual responses to vitamin D vary significantly. Some people require minimal amounts to maintain optimal levels, while others may need higher doses. However, exceeding safe limits without monitoring vitamin D metabolism and calcium levels is hazardous. Experts stress the importance of personalized assessment before adjusting intake. Unlike medications with clearly established dosage guidelines, vitamin D supplementation requires careful balance. Comparisons to blood pressure medication highlight the necessity of measuring and monitoring before prescribing higher doses. Despite the ongoing debate, the scientific consensus remains that excessive vitamin D supplementation should be approached with caution. While some patients may benefit from targeted high-dose treatments, the risks of toxicity, kidney damage, and calcium imbalances cannot be ignored. Until further research provides definitive answers, extreme doses should not be considered a universally safe or effective treatment. The growing trend of self-prescribing high amounts of vitamin D poses a public health concern, and individuals are strongly advised to consult healthcare professionals before making drastic changes to their supplementation routine.